Hi friends, welcome. This is Carla Colin, Program Manager with the Latino Chamber of Commerce of Boulder County. And after a few weeks off, we are back with Dr. Lizbeth Mendoza from Boulder County Public Health. And Dr. Lizbeth Mendoza is here to talk to us about an update on COVID cases, vaccines, and also a trending topic in the last few weeks about monkeypox. And she's going to explain a little bit about what it is and how we can prevent it from these transmission possibilities that are not crazy yet, but we really want to make sure to talk about it. Dr. Lizbeth Mendoza, welcome, and thank you so much for being here.
Hi, Carla. It's so great to see you all. Thank you for having me here. It's been a while, and there's a lot of stuff new. So, well, to begin with, the community level in our county is low. That's what we're seeing based on the numbers of new cases reported by labs, also the hospitalizations and the percentage of beds in the hospitals that are available for, that are taken for patients hospitalized with COVID-19. So this means that our systems of medical care or medical attention are not so strained or are not at high risk of being very strained. So that's a good thing. Nevertheless, there's 4 things that are super important to consider, not only now based on this report, but because of the pandemic in itself, how it's changing. One thing, the healthcare systems or the places where you go to get healthcare and the vaccination clinics, they are using the transmission levels still. Like what we used to do in the beginning, now these places are taking that number still. And for them, it's high. So that's the difference from what we see in the community to what we see in these hospitals and places of healthcare. Now, the other thing is that we're starting to use the water residue levels of virus, or the concentration of virus in our residual water, and we are seeing that the levels do not match like a low level in the community. So there must be something where we are not having all the cases reported. And why? Well, because there's less people are going to get tested in the laboratories. There's also less places to get tested in terms of being free and widely spread. But also people are using more of those fast tests at home, but they are not reported. And there's also a possibility that there's a lot of people infected, but they are not symptomatic. Nevertheless, they are excreting it, and that's what we see in the water. In Longmont, we have been seeing an increase in the water, in the concentration in water of the virus. In Boulder, it's stable, and Lizbeth is starting to go down. Now, the other thing to take into consideration is that we're going back to class, and these, the schools are opened again. And what this means is that in the future weeks, we most probably are going to be seeing more cases, more transmission, more cases. And the 4th thing to consider is, as we have learned, the subvariants or the variants. And at this point, the variant Omicron, as you know, is the widely spread, but the subvariant BA.5 is the one that is predominant in the country and in our state. And the good thing is that, as you probably also have heard, we just got the vaccine that is the bivalent vaccine, which contains both of the variants, the protection for both variants. That's why it's called bivalent. And this one is now available in our county. So this is great news. Now you get it, and you're going to get protection against the Omicron as well. And the one that is being, that we know is going to be circulating this fall and winter. So if we have chance, we'll talk a little bit more about that. But, just in case you're interested, just go ask in your pharmacy or with your provider, where can you get this vaccine? I'm sure that you can find somebody for you. Mostly if you have the insurance, you're going to go really fast. If you don't have insurance, we also have that vaccine in our county, in Boulder County Public Health Vaccination Clinics. And that's on Thursdays in the building in Longmont for Sun Brain Services building. So based on all this, the recommendation nobody's, we're not pushing anybody, like obligating you to do anything, but we really highly recommend you to continue, getting vaccinated, getting your boosters, getting tested if you have signs or symptoms of the disease, get isolated if you suspect that you have COVID or you actually have COVID because it came out in your test. Always be super attentive if you are being close to somebody who's in high risk of getting severely ill or being hospitalized or die. So what that means is if I'm gonna go visit grandma, I should probably get a test before going over there and make sure I don't have COVID, and at all times using my mask. Now wash your hands really well, 20, remember 20 seconds. We should be doing this forever and ever. We already learned it, and it not only prevents this disease, but many other diseases. Also prefer to be in places that are open, in the open space. And if you have to be in a place that is enclosed, then let's have a good ventilation system running in there. If your immune system is weak, then make sure that you are always close to your provider and always use like the really best quality masks for wherever you go. And if you really can't avoid going to places in public, well, okay, go, but always wearing your mask, and make sure that you have already a system in place so that the moment you feel like you may have been exposed or you have symptoms, you can get tested right away. And also visit with your provider, because remember that nowadays we also have treatment, but only work if you go early in the disease.
Sounds great. And now let's talk about vaccines. How are we doing on that, and who needs to keep up the work with these vaccines? I know last time we talked, the vaccines were very new for the little ones. So how are we doing on that first?
Yes, we're going there. So we at this point, we're only at 22% of the young kids who have been vaccinated at least with one dose. So we just remind the parents, please don't forget that this is a 2-dose vaccine. And those parents who haven't been there because you have fears that are very valid about, oh, this is such a new vaccine, or, maybe this is unsafe. I mean, as much as we're seeing in the country and people receiving these vaccines, also in the trials, and historically with the vaccines, these vaccines continue to prove that they are safe. And we have no reason to believe that there will be any long-term side effects associated to these vaccines. And we are not even seeing them yet. So, I mean, really just considering doing that. Yes, they do have side effects, but those side effects we know, and they happen with a lot of vaccines as well, but we don't have anything such as a long-term side effect that we have to worry about. Allergies are very low. The possibility of an allergy is extremely low. Myocarditis is also low compared to the possibility of having myocarditis if your kid contracts COVID. Now, we do have about 33,000 people in the county that are eligible but haven't gotten vaccinated, or they haven't completed their basic series of the vaccine, which is usually 2. So we just ask you, please come over and get your vaccine. They're nowadays everywhere, and you're not going to be asked questions if you don't want to share information. You don't have to necessarily share information, but you do have to give some information like your name so that you can get your card that proves that you were vaccinated. And then, of course, we want to say thank you to the almost 80% of the population in our county who are already fully vaccinated 2 doses, and about 70%, above 70%, who already have gotten their boosters. So that's a really good numbers. So these are good numbers for the communities in general. We are doing really great in our county. We just need the more people to jump into this and really make a way stronger community, mostly for the small ones and the elderly.
Perfect, Dr. Lizbeth. And now let's jump into the trending topic that we were talking about at the beginning, monkeypox. What's monkeypox? What does that mean? And what are the symptoms, and how are we preventing them?
Yeah, so we have the monkeypox, and I'm sure you have heard of it, people around. So this monkeypox is not a new vaccine. It's an older vaccine. Sorry, a new disease. It was an older disease that we already knew. And we knew that it lived like endemically in Africa and certain areas around there. And it was, usually you will have certain amount of cases per year and in certain people that were in high risk. But since a few months ago, we started seeing this disease in a lot of countries, which is extremely atypical for this disease. And a lot of cases too, extremely atypical as well. So the disease is changing. And we, at this point, is not something that we have to panic about, but this disease is highly controllable if all of us cooperate with stopping the transmission, not getting exposed to people who have it or in situations that are of high risk. And so, that's a message. Just be aware that this is happening. You can get sick. This has nothing to do with, sex or, what is your, certain habits. I mean, no, in general, this is not a sexually transmitted disease, by the way. And it's not just happening in one sector of the population. It can happen to anyone. I can say, and I want to ask you as our neighbors, to be aware that this disease is affecting, we're seeing that it's starting to affect more Latinos and also our people of color. So that's where we are seeing disproportionate numbers compared to the numbers that we have as a population of them. So then, we do have an issue with taking care of them. If you have friends who will belong to these groups or who are in high risk, please, just let them know, spread the word. And let them know that we do have also a vaccine for it, and it's called Jynneos vaccine. And Jynneos vaccine is a vaccine that is specific for monkeypox. It's been out there for a while. It's not new. Only this vaccine is not really we don't have a lot of monkeypox vaccines, so we're using it. So just for those who have been exposed, who already are sick, because this vaccine works even if you already contracted the virus, or for those who are in high risk, including medical personnel who are treating these people. So, so if you have certain characteristics that you can see in the website, and certain, you have been exposed in risk environments, please go and see if you can be eligible. It's free. Jynneos is free for now. And it's available in our county with us with Boulder County Public Health, the same in that building that I just mentioned, some Vrain Hub in Longmont, on Thursdays. So just to stay very attentive in the website for all the new eligibility criteria, the days of the vaccine, and the new developments of this disease.
Perfect, Dr. Lizbeth. Thank you so much. I will be sharing the link to the website so people can access it easier on the description of the video. We're also uploading these videos to our YouTube channel. So if you want to look for it later or you don't have time to finish watching it right now, you're more than welcome to visit the Latino Chamber YouTube channel. And just as a little reminder, we are going to have a vaccine clinic during our Fiesta and Food Trucks event. And we are going to have people that are going to be able to answer questions about vaccines and about boosters. So feel free to come and join us for some fiesta, some food, and also to get your boosters or your vaccines if you want to do it there. It is September 24th. But if you want to get your vaccines before, you're more than welcome to go anywhere. They're available everywhere now. So thank you so much, Dr. Lizbeth Mendoza. Thank you for being here. And it was nice to see you again.
Thank you, Carla. Thank you.
Bye-bye.
Bye.